trying to get an appointment with your doctor. It's very difficult. And I've been ringing to try and get an earlier appointment. Well, you can't get through because you're told to ring 8:30 in the morning. From my point of view, you can't get through. 20 odd calls before you get through. Everybody's trying to do the same as what you're doing.
And the first consultation then is always by telephone as well. So I couldn't do it. I couldn't deal with it. I did email and explain stuff, but I couldn't go up with actually talking about it on the phone.
Navigating mental health services is a minefield. If you're not what you would class seriously mentally ill, you get nothing. There still needs to be support for people with mental health. They may not be in crisis at that particular point, but they will get into crisis.
There's been times where I've been absolutely desperate and I've needed somebody there and then, and that help hasn't always been available.
It's the bits in between. You see your GP and come back in 4 weeks, and what happens in those 28 days? And you know, you early doors, you really got no idea, and you keep thinking, I can't be like this all the time. You beat yourself up mentally, you chastise yourself, you know.
It took me a long time to find decent support mechanisms, because I know GPs are fantastic at fixing broken legs, but they just don't seem to be that good at fixing people who've got like broken heads. You know, mental health, it seems to be something that they struggle with. Medication, that seems to be their answer. So if you want support that isn't like, you know, medically based sort of pills and potions, then you have to basically root around and speak to different people, and if you're really lucky, you might actually find somewhere like this.
I find it very difficult navigating mental health services across North Tyneside. I've rang in the past Newcastle services and they'll say that we don't provide that service, and they'll give me another number for North Tyneside. It's really confusing and really quite upsetting. If you're wanting some support or some information, and there's just so many different places, even in North Tyneside, that you ring and that pass you around, and that is hard.
The two services that I've used have been the community mental health team, eventually, because I feel like I had to fight far too hard to get that intervention, and then also used the talking therapies team through IAP. And again, I felt like that took far too long.
I've even been in A&E quite poorly and seen some lovely A&E doctors who referred me to the liaison team who were there, and then the A&E doctor themselves had to come back and say to me, I'm sorry, but they won't see you.
If you asked me about 30 years ago, I had no clue of where to go or what to access. I mean, I had counselling, but it was difficult to access more services in 1989 than it is in the present. I think I'm more aware of like what to look for and like what my needs are.
I'm still on the books of the Gender Identity Clinic in Newcastle. This is a regional issue, and obviously it's not just North Tyneside. And the clinic itself, I rate pretty highly. I've seen more than one psychiatrist as part of my ongoing transitional support and treatment, which is standard for people going through the system, as it's often referred to. And that's fine. The big difficulty with it all is just trying to get an appointment. Once you're referred by a GP to the Gender Identity Clinic, it can take up to 3 years in order to get your first appointment. If the waiting list is packed with people, you just have to wait. And the trouble with the stress of waiting is your symptoms don't go away, the issues you're dealing with don't go away, and the length of time you have to wait often means that crises occur in the waiting periods.
if I have a problem, I just ring up the CMHT, and they obviously have known me for years. I believe in the past it was a lot more difficult because there were so many steps to go through. Now, even though I said there's been too many reorganisations, they've got to a better place now, but they've got to that better place with fewer staff who are overworked. So they're never completely brilliant, the services, but they've done fairly well for me. It's just taken too long to get to the happy place I am now.
You know, I have to be honest, and my experiences of NHS and mental health services in particular, very positive. I've had a lot of help. I've had therapies and medication that's pulled me back from the brink several times.
The biggest thing I use for support and keep myself balanced is the mindfulness, the body scans, the meditations. But even on a smaller scale, if I'm anxious in a situation, I can do the breathing exercises to keep myself grounded. And other things that are useful are meeting friends and friends that I trust, who I feel a connection with.
But I was referred to a group called Launchpad, who were basically lifesavers. I met two very brilliant coordinators there, and the people who attended the group, service users like myself, had exactly the same pretty much problems that I'd had. So we all ticked the same boxes, and it was very encouraging to hear people who had all these experiences. I felt as though I wasn't unique and a freak or anything like that. I felt, I'm with a group of people, and I can actually say, yes, what you're talking about, I've experienced the same.
I also looked into what else there was available and found that my North Tyneside had quite a lot of help and support available, and once again the whole attitude was completely non-judgmental, completely non-labelling. It was about you as a person, and it was also a very positive thing, very supportive but also very positive.
If you've got a problem, seek help, but also seek support, because the two don't necessarily go together. So if you seek out help, i.e. you go to your GP or you contact another service, make sure you can get support, you can find advocacy, you can go to one of the charities like Ment or Launchpad or one of those, because you will not get everything you need from the NHS.
I've phoned the Samaritans numerous times. I found them brilliant. Sometimes you just need a break from the torment, just to pick up a phone and speak to somebody for 10 minutes. Look, this is my situation. I'm feeling desperate, I'm suicidal. And for someone just to listen to you.
I remember the first time I went into my new GP's, and I'd gone with some difficulties, but my first words were, please don't judge me by my label. And he said to me, I'm not interested in your diagnosis, I'm interested in you and what your problems are. And that set us off on such a good footing. And it just showed that he cared and that he was trying to understand.
I've seen in that time far too many senior house officers who I would say are the trainee psychiatrists, but they change every 6 months and on average, and you have to repeat your life experience to them each time you go in. I was only seeing someone every 3 months, So that was effectively 2 or 3 times, and then there was another change and you had to repeat yourself again. And I found that looking backwards is no good for me. I want to look forwards and change my life for the better, hopefully.
The psychiatrists I've seen have ranged from one who asked to see me at 7 o'clock on a Sunday night at the local place, and then rang me when I got back because he'd forgotten what he'd prescribed, which is just unbelievable. To another one that's just really sensitive towards it. But it depends. A lot depends on personal experience as much as anything else, or how you interact with other people.
Yeah.
You know, when you're pouring out your life and someone says, all right, well, you know, and then you've got to start that process again. It takes time to build a rapport.
And people not treating what was the obvious problem, but wanting to treat the symptoms. And I didn't understand that, and I still don't understand that, and I don't agree with it, but I think that's the medical model. And all people wanted to do was treat the depression. And I said, but if you treat the post-traumatic stress, I won't be depressed. And I feel like that, and the fact that I kept insisting on that, made me unpopular. You know, it's been recorded on my medical records that I complain.
Like you might get CBT you might get 6 sessions. I mean, my first point is, if you get accepted for the 6 sessions, you probably waited 6 or 8 months for that. And then as soon as you walk into that first session, there's always that negative thing in your mind, thinking I've only got 5 more of these to go, which isn't helping your mental health at all.
Edith was a very good counsellor, and she understood my needs, and she listened, obviously, to help me get well, but because it was such a concise set of appointments, I found I could improve my wellness a lot quicker than if it was like a protracted period. And also, my support worker, for example, she's very encouraging, she's positive. I find I've been around a lot of positive people now, who've obviously helped me keep balanced. And also in the serious space, the Tyneside mind workers, the wellbeing workers, were very supportive and understanding. And because of that, my confidence slowly improved around people and in social situations.
The services for instance, for me, I have a wonderful GP. She is absolutely brilliant, and she's brilliant at understanding my problems as well. But she treats all our family, and she is absolutely brilliant. She's got the time, and she'll listen, and she doesn't presume something.
I've had issues times when I've been in A&E and waiting to be seen, and again going back to your diagnosis, your label, and before they've seen you, they've made up their mind about what's wrong with you, what's not wrong with you, what type of a person you are.
Got an understanding set of GPs. They've been, one of them in particular, he's really good. I like him because he always asks me how I am, and then I always ask him how he is. And you would think that exchange didn't matter. Well, what it matters is it turns the doctor into a human being. If he says, "Oh, I'm not too well today," or "I've had a hard day," suddenly he becomes human. Then he knows, with this kind of signalling effect this communication has, if you ask the doctor how they are and they don't answer, they kind of like become something like machines or gods. You know, they never fall ill, they never have anything wrong with them. The reflection back at you of something which is like you helps you deal with yourself.
I've been treated very differently by lots of different people. Some of it I feel like I've been treated as a condition rather than a person. Some people have treated me with dignity and respect, but they tend to be the people who don't make any decisions. I feel like some people have just been really dismissive, and they've just not listened.
When I was with the GPs, instead of at the community mental health team, I was able to access talking therapies just last year, and that was so beneficial. The only drawback being that you have your 16 weeks and then that's it. And it would be so much better if that could be prolonged. You know, obviously ideally until you feel and the therapist feels together that what needs to have been covered or dealt with has been.
My dream would be that everybody knows what everybody else is doing, and at the end of the day, we're looking after people with mental health problems and carers, families. You know, I just want everybody to be able to work together.
And I mean, they need to catch people before the mental health gets out of control. You need to catch it early, and it would save so much money in services if you caught things early, rather than let them get to a point where they need professional help and it costs so much more.
If you've got mental health issues and you're dealing with a receptionist who's on the phone in a waiting area, the waiting area can hear, some people don't engage with that and it's very difficult. And then if you say it's urgent, if you get mental health, the urgent means like you're about to do something serious or self-harm or whatever. There isn't that rapport that, you know, you could code it, you could even say, use this word that the receptionist could pick up, and even having more telephone consultations rather than somebody say the doctor needs to come out because I can't come out because I've got a panic attack on, or you know, there's nothing that I would say is modern and innovative to, you know, to address some of these and speed it up.
I think the clinical services need to be much more aware of what's available in the voluntary sector. There's nowhere near enough publicity about them. Certainly nothing in either of the GP practices that I saw. I haven't seen any in public spaces, apart from, I did see one poster in Whitley Bay Library, but it was a generic poster and there was no real information on it. In all the time that I've been seeing people, i.e. GP, community mental health team, or talking therapies, did anybody ever offer voluntary services? Because I know that system needs strengthening.
I think be very empathetic with people, listen more, treat everybody as an individual and not just a number. And the way I would say that they could improve these services is to ask the people that use them.
We need long-term support from counsellors and other support groups within the other support systems within the community, which can help us, which are not specifically just on a timed basis, as you might say.
We're not sort of directly involved, indirectly through the forum, but not directly. I think that's missing. I think if you've got a service user involved, because a lot of service users won't come to a meeting because of the jargon and the professionals or whatever, but some would if they have support.
The recommendation I would make is, first of all, your first point of contact is your GP, and it's important that you're confident with that. Then when you're referred to someone else, if you do have a sympathetic GP, then they can refer you to someone that they would recommend as well. And if my own doctor recommended someone, I'd feel much better about that. So I still think it's all about establishing relationships, and it's your first point of contact.